Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
When teaching a preschool-age child how to perform coughing and deep breathing exercises before corrective surgery for tetralogy of Fallot, which of the following teaching and learning principles should the nurse address first? 1. Organizing information to be taught in a logical sequence. 2. Arranging to use actual equipment for demonstrations. 3. Building the teaching on the child's current level of knowledge. 4. Presenting the information in order from simplest to most complex. The correct answer is 3. Before developing any teaching program for a child, the nurse's first step is to assess the child to determine what is already known. Most older preschool children have some understanding of a condition present since birth. However, the child's interest will soon be lost if familiar material is repeated too often. The nurse can then organize the information in a sequence because there are several steps to be demonstrated. These exercises do not require the use of equipment. The nurse should judge the amount and complexity of the information to be provided based on the child's current knowledge and response to teaching. The nurse assesses the respiratory status of a client who is experiencing an exacerbation of chronic obstructive pulmonary disease secondary to an upper respiratory tract infection. Which of the following findings would be expected? 1. Normal breath sounds. 2. Prolonged inspiration. 3. Normal chest movement. For coarse crackles and rhonchi. The correct answer is 4. Exacerbations of COPD are commonly caused by respiratory infections. Coarse crackles and rhonchi will be auscultated as air moves through airways obstructed with secretions. In COPD, breath sounds are diminished because of an enlarged anteroposterior diameter of the chest. Expiration, not inspiration, becomes prolonged. Chest movement is decreased as lungs become overdistended. A client receiving a loop diuretic should be encouraged to eat which of the following foods? Select all that apply. 1. Angel food cake. 2. Banana. 3. Dried fruit. 4. Orange juice. 5. Peppers. The correct answers are 2, 3, and 4. Hypokalemia is a side effect of loop diuretics. Bananas, dried fruit, and oranges are examples of food high in potassium. Angel food cake, yellow cake, and peppers are low in potassium. The nurse is reading the results of a tuberculin skin test. See the picture on the screen. The nurse should interpret the results as 1. Negative. 2. Needing to be repeated. 3. Positive. 4. False. The correct answer is 3. The tuberculin test is positive. The test should be interpreted 2 to 3 days after administering the purified protein derivative, PPD, by measuring the size of the firm raised area in duration. Positive responses indicate that the client may have been exposed to the tuberculosis bacteria. A negative response is indicated by the absence of a firm, raised area, or an area that is less than 5 millimeters in diameter. Since the test is positive, it is not necessary to redo the test. The test is positive, not false. As hospital-based care has become more oriented to crisis intervention, criteria for admission to the hospital have also changed. Which clients have priority for admission to an acute care facility? Select all that apply. 1. Clients who live alone. 2. Clients who are acutely psychotic. 3. Clients who are acutely depressed. 4. Clients who are dangerous to self or others. 5. Clients who are not sleeping and have a lack of appetite. 6. Clients who are not complying with medication regimens. The correct answers are 2 and 4. Safety issues, including protection of the client and others, are the priorities for admission. Acute psychosis commonly involves issues of safety. Living alone is not a sufficient reason to be admitted to a healthcare facility. Depression, insomnia, lack of appetite, and noncompliance are important issues, but not sufficient for admission unless combined with one of the other criteria. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. An outpatient client who has a history of paranoid schizophrenia and chronic alcohol dependency has been taking risperidone for several months. She reports that she stopped drinking 4 days ago. The client is very frightened by the tactile hallucinations of bugs crawling under her skin. Which of the following factors should the nurse incorporate into plan of care when explaining the tactile hallucinations? 1. Alcohol intoxication. 2. Ineffectiveness of risperidone. 3. Alcohol withdrawal. 4. Interaction of alcohol and risperidone. The correct answer is 3. Tactile hallucinations are more common in alcohol withdrawal than in schizophrenia. Therefore, the nurse should explain that these hallucinations are the result of withdrawal from alcohol. Because the client stopped drinking 4 days ago, the client is not intoxicated. Risperidone has little effect on symptoms of alcohol withdrawal. It is prescribed for symptoms of schizophrenia. Alcohol and risperidone have an additive effect, not one of causing hallucinations. When conducting a mental status examination with a newly admitted client who has an Axis-I diagnosis of paranoid schizophrenia, the client states, "I'm being followed. It's not safe. They're monitoring my every move." In which of the following areas of the mental status examination should the nurse document this information? 1. Thought content. 2. Quality of speech. 3. Insight. 4. Judgment. The correct answer is 1. The client is voicing paranoid delusions of being followed and monitored. Presence of delusions is described in the area of thought content in the mental status examination. The speech section would typically include documentation of disturbances in speech or pressured speech. In the insight section, the nurse would document information reflecting a lack of insight. For example, statements such as, "I don't have a problem." In the judgment section, the nurse would document information reflecting a lack of judgment. For example, poor choices such as buying a gun for self-protection. The nurse who is caring for a client with kidney failure notes that the client is dyspneic, and crackles are heard on auscultation of the lungs. Which additional signs/symptoms should the nurse expect to note in this client? 1. Rapid weight loss. 2. Flat hand and neck veins. 3. A weak and thready pulse. 4. An increase in blood pressure. The correct answer is 4. Impaired cardiac or kidney function can result in fluid volume excess. Findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, an elevated blood pressure, a bounding pulse, an elevated central venous pressure, weight gain, edema, neck and hand vein distension, an altered level of consciousness, and a decreased hematocrit level. After instructing a multigravida client at 10 weeks gestation diagnosed with chronic hypertension about the need for frequent prenatal visits, the nurse determines that the instructions have been successful when a client states which of the following? 1. I may develop hyperthyroidism because of my high blood pressure. 2. I need close monitoring because I may have a small for gestational age infant. 3. It's possible that I will have excess amniotic fluid and may need a cesarean section. 4. I may develop placenta accreta, so I need to keep my clinic appointments. The correct answer is 2. Women with chronic hypertension during pregnancy are at risk for complications such as preeclampsia, about 25%, abruptio placentae, and intrauterine growth retardation, resulting in a small for gestational age infant. There is no association between chronic hypertension and hyperthyroidism. Pregnant women with chronic hypertension are not at an increased risk for hydramnios, an abnormally large amount of amniotic fluid. Clients with diabetes and multiple gestations are at risk for this condition. Placenta accreta, a rare placental abnormality, refers to a condition in which the placenta abnormally adheres to the uterine lining. It is not associated with chronic hypertension. Soon after admission of a preemie-gravida client at 38 weeks gestation with severe preeclampsia, the primary healthcare provider prescribes a continuous intravenous infusion of 5% dextrose in Ringer solution and 4 grams of magnesium sulfate. While the medication is being administered, which of the following assessment findings should the nurse report immediately? 1. Respiratory rate of 11 breaths per minute. 2. Patellar reflex of +2. 3. Blood pressure of 160/88. 4. Urinary output exceeding intake. The correct answer is 1. A respiratory rate of 11 breaths per minute suggests potential respiratory depression, an adverse effect of magnesium sulfate therapy. The medication must be stopped, and the primary healthcare provider should be notified immediately. A patellar reflex of +2 is normal. Absence of patellar reflex suggests magnesium toxicity. A blood pressure reading of 160/88 would be a common finding in a client with severe preeclampsia. Urinary output exceeding intake is not likely in a client receiving intravenous magnesium sulfate. Oliguria is more common. The primary health care provider prescribes pulse assessments through the night for a 12-year-old child with rheumatic fever who has a daytime heart rate of 120. The nurse explains to the mother that this is to evaluate if the elevated heart rate is caused by 1. The morning digitalis. 2. Normal activity during waking hours. 3. A warmer daytime environment. 4. Normal variations in day and evening hours. The correct answer is 2. An above-average pulse rate that is out of proportion to the degree of activity is an early sign of heart failure in a client with rheumatic fever. The sleeping pulse is used to determine whether the mild tachycardia persists during sleep or whether it is a result of daytime activities. The environmental temperature would need to be quite warmer before it could influence the heart rate. Digitalis lowers the heart rate, so the rate would be decreased during the daytime. When suctioning a tracheostomy tube 3 days following insertion, the nurse should follow which of the following procedures? 1. Use a sterile catheter each time the client is suctioned. 2. Clean the catheter in sterile water after each use and reuse for no longer than 8 hours. 3. Protect the catheter in sterile packaging between suctioning episodes. 4. Use a clean catheter with each suctioning and disinfect it in hydrogen peroxide between uses. The correct answer is 1. The recommended technique is to use a sterile catheter each time the client is suctioned. There is a danger of introducing organisms into the respiratory tract when strict aseptic technique is not used. Reusing a suction catheter is not consistent with aseptic technique. The nurse does not use a clean catheter when suctioning a tracheostomy or a laryngectomy. It is a sterile procedure. An infant weighing 9 kilograms is in the pediatric intensive care unit following arterial switch surgery. In the past hour, the infant has had 16 milliliters of urine output. Which action should the nurse take? 1. Notify the primary healthcare provider immediately. 2. Record the urine output in the chart. 3. Administer a fluid bolus immediately. 4. Assess for other signs of hypervolemia. The correct answer is 2. Urine output for an infant weighing 9 kilograms should be 1 milliliter per kilogram per hour. 16 milliliters of urine output is more than adequate for 1 hour, so the nurse should record the output in the chart. There is no reason to notify the primary healthcare provider regarding adequate urine output. The infant has adequate output, so there is no need for a fluid bolus. A fluid bolus could also cause the infant to become fluid overloaded, increasing the workload on the heart. There is no information in the question indicating that the child is hypervolemic. The nurse administers theophylline to a client. When evaluating the effectiveness of this medication, the nurse should assess the client for which of the following? 1. Suppression of the client's respiratory infection. 2. Decrease in bronchial secretions. 3. Less difficulty breathing. 4. Thinning of tenacious, purulent sputum. The correct answer is 3. Theophylline is a bronchodilator that is administered to relax airways and decrease dyspnea. Theophylline is not used to treat infections and does not decrease or thin secretions. The nurse's discharge teaching plan for the client with heart failure should emphasize the importance of doing which of the following? 1. Maintaining a high-fiber diet. 2. Walking 2 miles every day. 3. Obtaining daily weights at the same time each day. 4. remaining sedentary for most of the day. The correct answer is 3. Instructing the client to obtain daily weights at the same time each day is very important. The client should be told to call the physician if there has been a weight gain of 2 pounds or more. This may indicate fluid overload, and treatment can be prescribed early and on an outpatient basis, rather than waiting until the symptoms become life-threatening. Following a high-fiber diet is beneficial, but it is not relevant to the teaching needs of the client with heart failure. Prescribing an exercise program for the client, such as walking 2 miles every day, would not be appropriate at discharge. The client's exercise program would need to be planned in consultation with the physician and based on the history and the physical condition of the client. The client may require exercise tolerance testing before an exercise plan is laid out. Although the nurse does not prescribe an exercise program for the client, a sedentary lifestyle should not be recommended. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. Which of the following family members exposed to tuberculosis would be at highest risk for contracting the disease? 1. 45-year-old mother. 2. 17-year-old daughter. 3. 8-year-old son. 4. 76-year-old grandmother. The correct answer is 4. Elderly persons are believed to be at higher risk for contracting tuberculosis because of decreased immunocompetence. Other high-risk populations in the United States and Canada include the urban poor, clients with acquired immunodeficiency syndrome, and minority groups. A client diagnosed with schizophrenia is being switched to risperidone long-acting injection, which is Risperdal Consta. He is told that he will remain on his oral dose of risperidone daily for approximately 1 month. The client says, "I didn't have to take pills when I was on flufenazine decanoate shots in the past." The nurse should tell the client, 1. Taking flufenazine orally and by injection would not be as effective as the injection alone. 2. Risperdal Consta is less potent than flufenazine decanoate. 3. The doctor didn't believe you would take both the pills and flufenazine decanoate. 4. Risperdal Consta initially takes a little longer to reach the ideal blood level. The correct answer is 4. Achieving a therapeutic blood level is a slower process with risperidone long-acting injection. Oral flufenazine does not decrease the effectiveness of the intramuscular version and might increase the incidence of adverse effects. There is no evidence that the potency of the two medications is significantly different. Blaming the client for noncompliance with these two medications is inappropriate. A client who is suspicious of others, including staff, is brought to the hospital wearing a wrinkled dress with stains on the front. Assessment also reveals a flat effect, confusion, and slow movements. Which goal should the nurse identify as the initial priority when planning this client's care? 1. Helping the client feel safe and accepted. 2. Introducing the client to other clients. 3. Giving the client information about the program. 4. Providing the client with clean, comfortable clothes. The correct answer is 1. The initial priority for this client is to help her overcome suspiciousness of others, including staff, and thereby feel safe and accepted. Introducing the client to others, giving the client information about the program, and providing clean clothes are important, but these are of lower priority than helping the client feel safe and accepted. A pregnant client in her 3rd trimester is started on chlorpromazine 25 milligrams 4 times daily. Which of the following instructions is most important for the nurse to include in the client's teaching plan? 1. Don't drive because there's a possibility of seizures occurring. 2. Avoid going out in the sun without a sunscreen with sun protection factor of 25. 3. Stop the medication immediately if constipation occurs. 4. Tell your doctor if you experience an increase in blood pressure. The correct answer is 2. Chlorpromazine is a low-potency antipsychotic that is likely to cause sun-sensitive skin. Therefore, the client needs instructions about using sunscreen with sun protection factor 25 or higher. Typically, Chlorpromazine is not associated with increased risk of seizures. Although constipation is a common adverse effect of this drug, it can be managed with diet, fluids, and exercise. The drug does not need to be discontinued. Chlorpromazine is associated with postural hypotension, not hypertension. Additionally, if postural hypotension occurs, safety measures, such as changing positions slowly and dangling the feet before rising, not stopping the drug, are instituted. Police bring a client to the emergency department after she threatens to delete her ex-husband. She states emphatically, "The police should bring him in, not me. He's paranoid about my dating and has been stalking me for weeks. He's probably off his medicines. His case manager and the police won't do anything." In which order should the following nursing actions be done from first to last? 1. Ask about the marital problems leading to the divorce. 2. Assess the client's risk for harm to self and others. 3. Obtain the name of her ex-husband's case manager. 4. Interview the client about her current needs and situation. The correct order is 2, 4, 3, 1. The nurse should first assess the client's risk for harm, especially because the client could direct her anger toward her ex-husband or the nurse. Then it is important to know more about her current situation and her immediate needs. Obtaining information from the ex-husband's case manager might help clarify the risk of harm to the client. Problems leading to the divorce are less important than the situation following the divorce. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When caring for a multigravida client admitted to the hospital with vaginal bleeding at 38 weeks gestation, which of the following would the nurse anticipate administering intravenously if the client develops disseminated intravascular coagulation? 1. Ringer's lactate solution. 2. Fresh frozen platelets. 3. 5% dextrose solution. 4. Warfarin sodium. The correct answer is 2. Treatment of DIC includes treating the causative factor, replacing maternal coagulation factors, and supporting physiologic functions. Intravenous infusions of whole blood, fresh frozen plasma, or platelets are used to replace depleted maternal coagulation factors. Although Ringer's lactate solution and 5% dextrose solution may be used as intravenous fluid replacement, the client needs blood component therapy. Therefore, normal saline must be used. Intravenous heparin, not warfarin sodium, may be administered to halt the clotting cascade. Following an eclamptic seizure, the nurse should assess the client for which of the following? 1. Polyuria. 2. Facial flushing. 3. Hypotension. 4. Uterine contractions. The correct answer is 4. After an eclamptic seizure, the client commonly falls into a deep sleep or coma. The nurse must continually monitor the client for signs of impending labor. Because the client will not be able to verbalize that contractions are occurring, oliguria is more common than polyuria after an eclamptic seizure. Facial flushing is not common unless it is caused by a reaction to a medication. Typically, the client remains hypertensive unless medications, such as magnesium sulfate, are administered. A 79-year-old client is admitted to the hospital with a diagnosis of bacterial pneumonia. While obtaining the client's health history, the nurse learns that the client has osteoarthritis, follows a vegetarian diet, and is very concerned with cleanliness. Which of the following would most likely be a predisposing factor for the diagnosis of pneumonia? 1. Age. 2. Osteoarthritis. 3. Vegetarian diet. 4. Daily bathing. The correct answer is 1. The client's age is a predisposing factor for pneumonia. Pneumonia is more common in elderly or debilitated clients. Other predisposing factors include smoking, upper respiratory tract infections, malnutrition, immunosuppression, and the presence of a chronic illness. Osteoarthritis, a nutritionally sound vegetarian diet, and frequent bathing are not predisposing factors for pneumonia. After instructing a premigravida client at 38 weeks gestation about how preeclampsia can affect the client and the growing fetus, The nurse realizes that the client needs additional instruction when she says that preeclampsia can lead to which of the following? 1. Hydrocephalic infant. 2. Abruptio placentae. 3. Intrauterine growth restriction. 4. Poor placental perfusion. The correct answer is 1. Congenital anomalies such as hydrocephalus are not associated with preeclampsia. Conditions such as stillbirth, prematurity, abruptio placentae, intrauterine growth restriction, and poor placental perfusion are associated with preeclampsia. Abruptio placentae occurs because of severe vasoconstriction. Intrauterine growth restriction is possible owing to poor placental perfusion. Poor placental perfusion results from increased vasoconstriction. Which of the following is an expected outcome for an adult client with well-controlled asthma? 1. Chest X-ray demonstrates minimal hyperinflation. 2. Temperature remains lower than 100 degrees Fahrenheit. 3. Arterial blood gas analysis demonstrates a decrease in PO2. 4. Breath sounds are clear. The correct answer is 4. Between attacks, breath sounds should be clear on auscultation with good airflow present throughout lung fields. Chest X-rays should be normal. The client should remain afebrile. Arterial blood gases should be normal. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.